Good afternoon, class. I'm doing case study number 58, which is hypoparathyroidism. Hypoparathyroid disease. My case is about a 52-year-old female, her initials AW, who presented to her family doctor with reoccurring painful muscle spasms of both her hands and feet. Her skin is very dry, scaly, and puffy. She states that she has not been herself for 4 to 5 weeks. She's been very irritable, confrontational, aggressive, and combative. Her past medical history consists of being diagnosed with SLE 20 years ago. She's alcohol abuse, had corrective surgery for her leaking cerebral aneurysm 4 years ago, had multiple malignant melanomas removed from her face and her arms. She's attempted suicide twice, and she had a tumor ligation 29 years ago after her last son. Her family history: her father died at the age of 70 from pancreatic cancer. Her mother died 2 weeks later from heart failure. Ironic. Her younger sister has a history of bipolar and suicide attempts as well. Her brother died at the age of 38 from acute myocardial infarction. She had 2 other brothers die from lung cancer, and a 3rd brother who died soon after birth from hydrocephalus, which is fluid of the brain. For her social history, she's a divorcee with 2 children who are estranged to her, have no contact with her. She lives with a friend of hers. She's a former SENA who is now on disability, and she's an alcoholic and a smoker. She currently takes over-the-counter medications for her heartburn, and she takes steroids for her arthritis secondary to her lupus. She has no known drug allergies. She has sensitivity to sunlight, which causes erythematosus and macular rash when it comes into contact with her skin. Her vital signs are all within normal limits, and as stated above, her skin is dry, scaly, and puffy. What led up to the diagnosis of her hypoparathyroid disease? Poor nutrition, alcohol abuse, dry, scaly skin, mood swings. Her current weight, she's 97 pounds, and for her age and height, she should weigh a little more. So she's underweight, not quite malnourished, but definitely underweight. Her lab results are all within norms, except for the following lab results, which she tested they're high or low for. Her MCV was high, it was 110. Her red blood cell count was was low, which was 4.2 millions. Her GGT was high, which was 114. Her PTH was low, which was 4. Her folate was 120, which is low. Her B12 was low, which was 63. Her PO4 was low at 0.2, and her ECG showed a prolonged QT wave. The norm for the MCV was 80 to 100. Her red blood cells should be 4.7 to 6.1 mil. Her GGT should be between 9 and 85. Her PTH should be between 11 and 54. Her folate should be between 165 and 760, and her B12 should be between 140 and 820. Her PO4 should be 1 gram per 24 hours, and hers is 0.2. And her ECG, everything should be within a normal sinus rhythm, which it's not. Her GGT level is abnormal just simply due to the fact that she's an alcoholic and her liver's probably been destroyed, so it can't filter out any of the toxins. Which her alcoholism led her to the hypoparathyroid disease, and her blood is so low, her hematocrit and hemoglobin are low because her blood is like water from over the years of alcohol abuse. Pharmacologically, try to do it without by giving her an increased dose of vitamin D, a diet rich in calcium, way to go, maybe magnesium supplements, calcium, oral calcium tablets if she can't tolerate the taste of milk or cheese or anything like that. Let's try dihydro cholesterol and calciferol. They'll help with the hypoparathyroidism as well.